Welcome to the Team Teach podcast. I'm Claire, and in each episode you'll find me talking with an expert guest to learn more about behaviour. We squeeze a lot into each episode. You'll listen to the latest thinking in behaviour, continue your professional development with our book recommendation, and then I'll send you away with 3 practical tips you can use in your setting. And if this leaves you wanting more, you can watch, listen and read our wide range of resources right here in the Team Teach Hub. I'm joined today by Dr. Tina Rae. Tina has 40 years experience working with children, adults and families in clinical and educational contexts within local authorities and specialist services. She is currently working as a consultant educational and child psychologist in a range of social, emotional, mental health and mainstream contexts, and also for fostering agencies as a consultant psychologist supporting foster carers, social workers and looked after children. Tina is a prolific author and has over 100 publications to date. And this is the first part of a 2-part bumper episode where Tina and I are talking about emotionally based school avoidance. Enjoy the episode. Hi Tina, how are you?
I'm great, thank you. How are you doing?
I'm really well. It's so lovely to have you on the podcast again. You were a big hit on our previous podcast we did around bereavement. And actually with your expertise, experience, we begged you to come back on again and talk about emotionally based school avoidance, which obviously is a difficult topic in many ways. And I know that probably COVID would have impacted this somewhat, I think, as well. But we're going to start off with a question. What you know now that you wish you'd known then about this topic?
I think probably before I wrote the book, and through many years of kind of working with children, families, parents, and, the school staff. And at the time, I would say this is probably about 30 years ago when I was working as a behaviour support teacher and trying to reintegrate kids back into school who really didn't want to be there. I think if I had known a lot more about neurodiversity, if I had understood the impact of a child having autism, sensory integration difficulties, and the emotional strain, and particularly around having to go into a situation where they felt clearly unsafe, I think I would have been in a much stronger position to support them effectively, because we would have known how to work with staff and the family in terms of actually providing a much more bespoke programme, of reintegration for that child. Because I think that there is something about, this lack of understanding of what it is to experience this when you come from that perspective, and so many kids have these additional needs. And it really does mean that the school as an institution, as a staff team, have to, in my view, actually really make these adjustments, because otherwise, you're on a hiding to nothing. You will get a little bit of success, but then something will happen to that child during the school day that triggers off a sensory reaction in some way that makes them very, very frightened and anxious, and they could have a panic attack, etc. So I think I really wish now that I had much more knowledge and understanding of neurodiversity, really.
It's so easy to look back, isn't it, and be like, oh, if only I'd known that. And I suppose we learn through doing and through experience, don't we? But
yes, yeah.
I do think that the knowledge base and the evidence and all the things that kind of help us as practitioners now is there. And I suppose that leads us on really nicely to thinking about you, Tina, and a bit more about your experience, particularly with this topic.
Yeah, I mean, I've been working in this area for a long time, and I think after and during the COVID pandemic, it became very clear to me that this was a significant issue and going to be a significant issue, particularly for that neurodiverse community, for example, and others, more vulnerable, emotionally vulnerable kids, who actually found being at home a relief. Because they didn't feel oversensitized. They weren't worried about those busy playgrounds, the corridors, people pushing them. Dare I say it, the bullying, because this is the key factor in many of the cases that I've worked with, is bullying. But also the fast pace of things. And I think when the children were going back into school, we've seen so many more kids finding this so incredibly difficult. So someone was saying to me yesterday, they'd read something a new piece of research that had come out around children in years 9 and 10, and something like 1 in 5 of them are not actually back in school full time across the country. So what does that say to us? It's been so significant, it's so difficult to get them back in. And I think a lot of that has been the anxiety, social isolation, but also trying to get back in when you feel, lots of children have said to me, I can't catch up. I can't do the work. I feel stupid. People are going to see this. I'm going to be behind and I'm never going to be able to catch up. And also, I don't know how, a younger child said to me, I don't know how to be friends anymore. And I don't know if my friends will want to be with me. You know, so I think there are lots and lots of issues that have arisen due to that. So for me, this has probably been one of the main areas of my work in the last 3 years, is supporting families in particular, but also working with school-based staff to actually formulate plans that are really effective. And that effectiveness relies very much on this approach that is a team approach, hearing everyone's voices and incorporating them into that transition planning. And I would say that in the past, one of the things I regret very, very much is that I don't think we heard the voice of the child.
Maybe I'm thinking more from secondary school perspectives, but I don't think the voice of the child is often heard, or sometimes there's a lack of empathy, compassion around these genuine anxious feelings about, you know, stepping foot into a building. I mean, I've worked in lots of different settings where I've seen a lot of school avoidance, and I think one thing that's really stuck out for me is the labelling of it and how it's kind of changed over the years. And we might have talked about school refusal, we might have talked about, you know, or they're just not coming in, you know, and now we kind of get to the crux with this, I don't want to call it a label, but new term perhaps for it. Where's that come from, that term? Where?
I think it's evolved because I think with our understanding of trauma-informed practice, for example, and understanding of how the brain works, what anxiety is, how it manifests itself in the body particularly, I think we've kind of moved away from what I would call quite a pejorative terminology, because school refusal for me would suggest that someone is making a concrete choice to say, I'm not doing this. Whereas school avoidance, to me, is a much more compassionate terminology or label, if you want to call it that, because actually what that is saying is, I can't do this. It's not that I don't want to be here. It's not that I don't, but I am so frightened. I am so overstretched and stressed by it all. I can't do it, you know. And if you see a child with that level of anxiety, you know it is absolutely genuine. And I think previously, for many years, there's been this kind of notion that actually they're making a choice to do this, that mum or dad are colluding with them. And actually they're just a truant really. And actually they need to get over this anxiety. They just need to take a deep breath and pile themselves back in. And, you know, and I think also that there was a tendency in some instances, not all, but in less compassionate environments, to label the parents as being the root cause. And I think that's difficult because from my perspective, when this works well, when we can really support children effectively, it's when we don't put those labels on everyone else. I mean, I think there is a minuscule number of people who may be colluding with their child. There are a minuscule number of people who maybe don't actually care if their child is, you know, bunking off, basically. So they're truanting. But truanting and collusion, that is not what this is about. This is about, generally, most of these parents will be coming in and saying, I'm desperate. I wake up in the morning, I find my 6-year-old clinging to me, arms around my neck, sobbing, saying, please, mummy, please don't make me go in, don't make me go in. And then what do I do? Because you think about it, and I've heard people in the past saying, oh, we've got to get them in, we've got to get them in as soon as possible, we've got to nip this in the bud. So I've had times when I have witnessed, sadly, in some institutions, a child being dragged into school, screaming in total distress, in a meltdown, and then they will sometimes just dissociate as a means of coping with it. But I think that's actually abuse. I think that's cruel, and I'm so glad that the narrative has shifted. And we've got far more understanding of where this is coming from, what it really is, and it's anxiety. And it's a phobia, you might want to call it a phobia, but it is an anxiety, and that needs to be treated, that needs to be supported. And a child needs to be nurtured in that context, not labelled, not stigmatised. And the parents certainly don't need to be.
Did you know that you can become a trainer and deliver Team Teach training to staff within your own organisation? Have the flexibility to choose when, where and who you deliver your training to throughout the year. Find out more about this cost-effective option on the Team Teach website. And I'm just wondering where it's coming from, though. So I think about one individual in particular, and the root of his avoidance of school was one incident that had happened a long time ago. I won't go into details, outside of school. And then he developed, I would call it almost a phobia of coming back in case he saw that person, even though they'd gone to a different school. And it was like a whirlwind. And at home, his home was so supportive and were desperate to get him back in. He was a teenager. It's pretty tough to drag someone kicking and screaming at that age in, so that tactic obviously wasn't going to happen. But I could see the root of his avoidance there through, you mentioned kind of bullying, I guess, that was the crux of it. But what are some of the things that might cause a child to develop that phobia? Because someone else might have that experience and then, it's done, dusted, and that doesn't develop.
Yeah, I mean, it depends how traumatic that experience is of bullying, isn't it? And how long it's gone on for. And it could be one incident, it could be lots continuously over a longer period of time. It's, whatever it is, it will be unique to that child. And I think that's important to remember the unique nature of this. But also, I think there are things, I mean, what a lot of kids have been saying this time after COVID is, I've got so behind with the work and I'm going to feel stupid and I can't, and they are overwhelmed.
Yeah.
I mean, one of the key factors in kids who self-harm, for example, is not just relationships with friends, social media and all that stuff. It's to do with workload and pressures of work, and particularly at the high school level, that is overwhelming. And it just gets to the point where it feels like this brick wall because the child feels so far behind and looks at what they're supposed to be doing and thinks, I can't do it and I don't want to be with my peers and be ridiculed. For some, I think it is really just, if you have gone into a context, I think there's a real danger point between transition from primary to secondary. And for lots of our kids at that stage, going from a much more nurturing, smaller context can be totally overwhelming. And that's really, for me, one of the biggest, and we know it from the research, one of the biggest risk factors of all. So I think it's work, I think it's relationships, I think it's bullying. I think as well it can be when a child doesn't feel, and the recent research from a group of EPs have conducted this, around a sense of connectedness.
Yeah.
They don't feel part of the tribe. They don't feel part of that group of children, that group of young people. And I think, Adrian Bethune, for example, does a lot of stuff about the tribal classroom, which is absolutely excellent, making people feel that they're part of it. You're not the odd one out because you have this difficulty or that difficulty, or you don't fit the so-called whatever the normal mold is. So I think there are many, many reasons, and very, very varied. And for some kids, it can simply be someone's died. My mum might have cancer. And think about COVID, and children were experiencing deaths and bereavements, probably many of them much more earlier than they probably previously would have expected to, because grandparents may have got it and died earlier, so lots of various reasons, really.
There's lots of various reasons, but just going back to that tribal classroom, that connectedness, is there something that practitioners can do to enable that tribalness? Definitely isn't a word, isn't it? I'm making it up, but to enable that connectedness within the classroom, how do we get there, and how do parents help? Because I think sometimes parents will be knocking on the door of school and be asking the right questions, maybe quite distressed themselves, but how does that conversation then translate to an actual change in the setting? Because there's often a disconnect there, isn't there?
Oh, there is, yeah. I mean, I know that I think there's something about that connectedness with children. We're a team together in our form group. What are we going to do? Let's have this group project together. It's something that we're actually coherently doing. But also, these are our in-jokes. We're part of this, so no one's left out. And I think that's something that, even on a daily basis, you can ensure that. And activities, as a whole class that you're doing, teaching each other skills around calming, self-regulation, all of that stuff that can be shared. And it's like, we're in this together. It's promoting and pushing that narrative, because then, and what's the kind of philosophy in this room? What underpins what we do? We actually are here to support each other. We're a team. We're going to look after each other. We're going to make sure everyone's okay. What are the 3 good things we're all going to do for each other today? Who is going to be my person that I'm going to do something special for? All of that positive psychology stuff. And I think a lot of teachers are brilliant at it. I think it is harder in a high school, and I think it will be down a lot to individual teachers and their subject areas, but also the form tutor, but I do think that is important. And I think parents understand that and can help and contribute to that by supporting their kids to become part of that team, to come up with ideas, but also I think there is something about just being very clear about how we support children with anxiety and what measures the school takes in terms of like a calm space, a safe space, allowing that child to have that exit card when they need it. And I've heard people say, oh, they'll abuse that. Well, actually, most kids clearly don't abuse that at all. But, obviously in agreement with parents. And I think this is key. I'm always asking kids, and I spend a lot of time talking to them individually about what is it that worries you? When isn't it quite so bad? So that solution focusing. Who do you feel safe with? When do you feel okay? What lessons do you think you might manage 10 minutes or 5 minutes or a whole lesson? How do we want to play this in terms of what your needs are? What stresses you out? What makes you feel okay? And I think it's about getting that perspective and then sharing that with the teachers, with the parents, because I think very often that's not heard. And there's this kind of push because there's so much pressure on school staff around statistics, your attendance, is it 80%? Oh gosh, no, they're going to come down as well. I think we've got to be much more passionate about driving forward a more bespoke option here, so that each child who has this issue will have an individualized safety plan made up for them with, this is what's going to happen step by step by step. And I think it's not too difficult to think of this as a plan that is jointly owned by everybody, but is also reviewed on a regular basis. And it has to be longer term. I think there's so much pressure on school-based staff to say we've got to get them back in the next couple of weeks, but it doesn't work like that. It has to be very, very small steps that we review regularly. And for some kids, that might take months to make that happen. It might take another month to get a child from the school gates into 2 lessons a week. And between that, there might be another 20 steps. And I think sometimes people say, oh, God, that's a lot of work. We haven't got the time to do it. And I think, well, if you don't do it, you're going to lose this child, because the moment you try and push someone too quickly, you flood them. And then what happens then, I think, is that you're at risk. I mean, I'm just the analogy of a swimming pool. I always use this. If a child can't swim, you do not throw them into the swimming pool, because they'll drown. And you wouldn't dream of doing that. And it's exactly the same when a child has emotionally based school avoidance, anxiety. You can't just throw them back in. No. It has to be very, very gradual.
And that was part 1 of a 2-part bumper episode with Dr. Tina Rae. Tune in to the next episode to hear the final part. You've been listening to the Team Teach podcast. It's been great to have you here with us as we discuss behaviour, communication, and the ways we can best support those in our care. Thanks again, and I'll see you next time.